This podcast is made possible in part by WKTV Community Media.
Welcome to the Be Nice podcast, where we dive into conversations that help us recognize, understand, and most of all, take action when it comes to mental health and suicide prevention. I'm Christy Buck, your host. The Be Nice action plan is simple. We review it all the time. Notice, invite, challenge, and empower. 4 steps that can change a life. Together, we'll share real-life stories and tools to break the stigma around mental health and inspire positive changes in our communities. Remember, the number one reason people don't seek help and treatment is stigma. Open conversations about mental health, challenging myths, and talking about resources reduces stigma, making people more likely to seek help and treatment. Myth busting can be life-saving. So today's myth: LGBTQIA+ folks just need to go to therapy. Any sort of therapist would help LGBTQIA+ folks. Here to help unravel our myth is a new good friend of mine, Brittani Decess, a licensed professional counselor at Health for Life Counseling in Grand Rapids, Michigan. Brittani is a trauma-informed therapist and EMDR trained. Her areas of expertise are domestic violence, sexual assault, abuse, neglect, relationship issues, relationship dynamics, sexuality, and kink. Non-monogamy. Non-monogamy. We're going to talk about this. And LGBTQIA+ experiences. I know I'm going to learn a lot, and I hope you will learn a lot also, and most of all, reduce the stigma. So, welcome to the podcast, Brittani. I just start off all the time with, tell us a little bit about yourself, where you're from, anything you want to share in respect to that, and then we're going to get into this myth busting.
Thanks for having me, Christy. What are your pronouns, by the way?
My pronouns: she, her, she, her.
I think she, her.
Yeah.
Yeah, mine are she, her too.
All right.
So thank you for having me, Christy. A little bit about me. I grew up in the East Lansing area, so capital city of Michigan. I did my undergraduate degree in Milwaukee, Wisconsin in art therapy, which was a really, really fun experience. I went to a college that did not do a grading system. It was either pass or fail, and it was also an all-women's college. And the level of uplifting and empowering there just like really instilled a lot of my philosophy on life going to that college. And then I moved to Kalamazoo to work on my master's in counseling with an emphasis on marriage, couples, and family at Western Michigan University. And I did my internship in Grand Rapids, and I realized that like Grand Rapids just felt more like home. And I also realized moving from Kalamazoo to Grand Rapids that there was a lot more need for specialized modalities because of the culture in Grand Rapids. And so that's part of the reasons why I have those specialties of domestic violence, sexual assault, abuse, and neglect, and then all the realms of relationships. So queer experiences, sexuality, non-monogamy.
Yeah. That's tough. That was a hard one.
Yeah, it's a big word.
Yeah, I love it. Okay, so we're going to bust it out. So
Please
we're going to go for this myth. So LGBTQIA+, people just need to go to therapy. Any sort of therapist would help LGBTQIA+ folks. Bust it for me.
I'm going to bust it. So I think like my question on that myth is like queer folks just need to go to therapy. And if the underlying message there is something wrong with you because you are identifying in any of those letters, LGBTQIA+, what we know through so much research and through many of our organizations is that we know that being queer is not an illness. To kind of speak on that, the DSM, the Diagnostic Statistical Manual, which doctors, mental health professionals use to help diagnose clients and patients, being a homosexual got removed in 1973. Yeah. So the Diagnostic Statistical Manual realized like this is faulty, that we're saying like if you're gay that there's something inherently wrong with you. The World Health Organization also recognized in 1990 that they removed that as a diagnosable illness as well. And 1990 really isn't that long ago.
No.
So our society really hasn't caught up to this idea. And think about like the impact of stigma there. So we had it removed in 1973, then we had it removed in 1990, and we are still kind of falling back on, well, if you're gay, there must be something wrong with you. And then the APA, the Association of Psychologists, found through lots of research there that being queer is not a choice. It is something that you are born with. It is not linked to psychopathology. Again, another big word. And so psychopathology basically means that what is the thing that is causing symptoms of distress? And what is the illness that is causing those symptoms? And what we're recognizing through research that it's not being queer that is the distress. It is homophobia, it's transphobia, it's internalized messages, it's how our capitalism and consumerism and patriarchy impact. It's all of our broken systems in our education, in law, in our judiciary system that really are impacting our queer folks. And that is what's causing the distress. It's not being gay, lesbian, trans, non-binary, etc.
And we're speaking right before we came into the interview about Be Nice, right? And that is that overarching upstream approach to having a greater understanding that the impact of how we treat each other. And so at that macro of Be Nice, it's got the action plan, notice, invite, challenge, empower. And a lot of it macroly is notice the good, the right in people, no matter what. Invite myself to notice good, right. Challenge stigma. Challenge those stigmas you just busted myths beyond belief today on this podcast. I have the chills. I can't thank you enough. And that's exactly what we need to be doing, is challenging what people say about any individual, right? And then that empowerment. And then most of all, we know that our community that we are talking about right now today are at risk because who they are. And that puts that challenge onto their mental health. And so more stigma busting I want to do, and this is where I want to really talk about rates of experiences in people's lives right now that we need this conversation to be happening to help embrace all human beings, right? No matter who you are. So I want to talk about what are some of these challenges amongst the LGBTQIA plus folks, what they're experiencing. And I'm reading, obviously I do a lot of reading all the time because I want to be up and factual. So I want you to help me, Brittany, talk about those rates of homelessness. I mean, I think people will be shocked. We're talking about victims of abuse, and this is some of your specialty, thank God. Rates of suicide, isolation, hopelessness, that protective factor that all people need, and that's from family. And so oftentimes folks do not have that. So break some of these things and help me to really get the word out.
Absolutely. I'm going to give you so many statistics.
Go, girl.
Your brain is going to be dizzying.
Yeah.
So one of the things you mentioned was homelessness. Through the Generation Study and the U.S. Trans Population Health Study, some of the statistics that they came up with is that LGBTQIA plus are 7 to 9% more likely to be homeless of the 40% of youth that are already on the streets. So if we have 40% of youth already unhoused, 7 to 9% of that are probably LGBTQIA+. Queer folks are 120% more likely to experience homelessness or being unhoused, or I like to call it the not quite homeless, which is also like going from couch to couch or from friend to friend. They might not be physically on the streets or in a shelter, but they also don't have a home to call their own. 20% of queer folks before the age of 18 are also probably unhoused or couch hopping or experience homelessness because of rejection or mistreatment from their family members. Again, maybe it's because of family belief systems or religion or other conservative ideas regarding our LGBTQIA+ that sometimes our youth decided that being not in their family home is safer than, the risks of being unhoused. And then a lot of our LGBTQIA plus age out of the foster care system, and 40% of them also experience homelessness or being unhoused. Any questions or any comments on that before I
keep it going, girl?
Okay, so we're domestic violence, sexual assault, abuse, and neglect is obviously some of my specialties. So this has a nice near and dear spot in my heart. And so there's like two different ways we can think about this. We can think about the abuse and neglect that is experienced at home, and a lot of our LGBTQIA plus are not feeling affirmed in their home. And even if they stay in home, like they might not be affirmed in their gender by using their pronouns or using the name that they feel most resonates with them. There might be actual physical or emotional abuse because of that. And so some of the statistics around there is 4 to 5 times the LGBTQIA plus are more likely to experience violent victimization. So that can be hitting, being beaten up, those types of things. According to the 2010 National Intimate Partner Violence and Sexual Violence Survey, kind of breaking it down on genders here. Again, gender is a spectrum, but unfortunately I'm going to speak in binaries here. That for people that identify as women, 61% of bisexual women, 44% of lesbian women, and 35% of straight women have experienced intimate partner violence or domestic violence. So the other end of that gender binary is 37% of bi men and 29% of straight men have experienced intimate partner violence. And then in our 2015 United States Transgender Survey, 54% of trans folks have experienced violence with an intimate partner. So we're talking about family, we're talking about homelessness, we're talking about the abuse or the violence that they are encountering, which to me is all the reasons why suicidal ideation, self-harm, and those types of things get even more impacted. Yeah. So according to the Trevor Project, 40 to 48% of LGBTQIA plus said that they have thought about suicide at one point. And then on top of that, 10 to 20% have attempted. And this is a statistic mostly regarding youth. Trans and non-binary folks have thought about suicide at least 50% of the time, and then by the time they're adults, 17% of those folks have tried to attempt that. The biggest causes for that, as that already mentioned, is the bullying, the prejudice, the transphobia, the queerphobia, and then unfortunately the political climate right now is also really impacting our youth and our adults that are identifying in the LGBTQIA plus spectrum. Yeah,
it's shocking.
Yeah.
And it goes right back to that action plan. Understanding the risk factors that our folks have, right? And understanding that it's even more important to be paying attention to, one, obviously how people are being treated, making sure that I know what type of protective factors I can give to someone, right? Mm-hmm. And I think that those protective factors oftentimes are access to services, right? Mm-hmm. And actually utilizing the resources. And so that's where I want to jump to. Where are those resources available that we can lead people to? And I know right now we're in Grand Rapids, but I know on a national front there are, and thank God the Trevor Project is back, right?
Yes, we're so excited about that.
I know, and that's that affirmed, trusting individuals that you're going to get when you are having difficulties and challenges and potentially suicidal ideation. So break down that for us, that there are resources that people can access.
Mm-hmm. I might jump around a little bit because I do want to also address your, what types of therapy are good for LGBTQ.
Right there, that's empowerment.
That's empowerment. And so I always think that if you're looking for a therapist, there's plenty of places to look for that. Obviously, you can Google, LGBTQ plus therapist in your area. There's also Psychology Today. and therapyden.com. But some of the things I really advocate for anyone that is searching for a therapist is try to get at least a 15-minute conversation with that therapist to ask some really important questions. Some of those questions that I really advocate for is asking this therapist if they are affirmative therapists. And what that means is they are inclusive and trauma-informed in the care, and realizing that there is systemic issues at play with all the things that I mentioned, and they know that. And they know that being LGBTQIA+ is not an illness. It is everything else that's happening around them that really needs to be talked about. So I always ask, too, that if it's not explicitly stated somewhere in their bio or on their page that this is something that they have specialty in or experience in, like maybe be a little wary. But some of those other resources, like you just mentioned, we have the Trevor Project. I think they do amazing work. There is, at least in our local area, we have the Grand Rapids Pride Center, the Grand Rapids Trans Foundation. We have the LGBTQIA+ Healthcare Consortium in Grand Rapids. And then some of those other resources is what I would maybe call some soft lines. So they're there to listen, they're there to help. They hopefully also are doing some of that work to de-escalate someone who is having those suicidal ideations. And what I like about some of these too is that they aren't necessarily hospitalization focused or police focused. And some of those lifelines are the Trans Lifeline at 877-585-8860. And then we
One more
have
time.
877-585-8860. And then we have another soft line, the LGBTQ National Help Center at 888-843-4564. Again, that was 888-843-4564. And then at least in the Kent County area is Network 180, and they have a mobile crisis hotline as well. But unfortunately, I don't remember that number at the moment.
We're going to get that number because I knew it a moment ago, but I know 336-3909-616 is Network 180. So that also is the access center. And then the mobile crisis, we're going to get that number.
Thank you so much.
But these are good resources. And we know that even out of county, there are community mental health systems also. So if you are living right now in another county outside of Kent, make sure you Google or look up that county where you live and have that resource. And that's what we're always telling people also, Brittany, is have these phone numbers handy. And if you yourself, you've never been suicidal, you've never thought about taking your life, you have not had these mental health challenges, your friend may. So you're going to have those numbers ready to go. That's one of the best things that the state of Michigan did was mandate that students were wearing the phone number 988 on their IDs. Now we're allowed signs all over the place in schools, in businesses, right, where we have that. So that's really super important. You know, for a lot of businesses, we recommend having EAPs, and I think that's another thing that we, as Be Nice, are going to make sure that we're going to challenge that the EAPs that they connect with have certain clinicians that have specialties in different modalities, right?
Yes.
So that's just holding people accountable for making sure that we are across the board servicing everyone. What else? You know, another big thing, and I know this, is that how do you work with folks that are struggling with family? What do we do in that point? Is it leave your family? Is it, what do you work with in these situations where they've lost that big protective factor that had always been there for them, and now they're alienated, they're written out of the picture, written out of life?
I think one of the things that I find really important is really trying to advocate for them to find a community that is outside of their family of origin. So there are so many local events, there are so many meetups, there are so many fun things, and even if that's not necessarily something that is a part of their identity, so maybe they're not going to a queer-focused event, if they like crafting, if they like D&D, if they like magic, like find people that you can start connecting with there. I also ask about about teachers and coworkers and bosses as someone that they can connect with and help them recognize that these are people that if you need someone to hang out with or talk to or confide in, to maybe do those things. I hesitate to be like, leave your family. Those are buttholes and, you deserve better. And because I think we forget that to leave home can be very, very unsafe. And then again, we have all of these systems that are still working on these old biases and stigmas that make that really hard. So if a person is of age and is able to, then we might talk about like, okay, do you have an income? How do you get an income? What are the resources in the community to help you get job skills or certification? Or, I've had clients bring in whole applications and we sit the whole session being like, how many applications do you want to do? Let's do that together.
Wow.
Because helping them survive after they leave is really, really important. And going back to like my domestic violence and sexual assault techniques, those are, again, the first two things, even in that we always work on is, do you have the money to leave and do you have community? Because isolation and being able to provide for yourself are the biggest barriers to safety.
Yeah. And that's exactly it. That's why those two most important pieces of protective factors are access to resources and utilizing those. Because again, oftentimes therapy isn't just about talking about it. It's about taking a hold of this and empowering that individual with help and making sure, that's a scary thing. I mean, even applying for jobs, not even know where to turn, right? And you already are internalizing who you are. Are they going to hire me because of the choices that who I am, who I am. Okay, so this is going to go my last myth busting. And we've spoken a lot about the Q in LGBTQIA+, and it's queerness. So queerness is relatively new phenomenon, even though the word queer has always been utilized. Me, a girl from the 70s, right? It's really important that we understand where these terms have come from, and even the adding on of the I and the A and the plus. Just quickly, can you touch on that?
Quickly, with so much history?
Right?
So queerness, I would say, 70s, 80s, and I would say even early 90s, queerness was akin to the F slur, which I don't want to mention. Maybe we can put an asterisk or a disclaimer somewhere else if people are not aware of what that is. And I think come the late 90s and through the 2000s and the 2010s, LGBTQIA folks have kind of reclaimed that as an overarching term. It used to be gay was the acceptable umbrella term, then, homosexuality was the overarching umbrella term, and now it's become queer as the overarching umbrella term. I think the asterisk disclaimer star here is not everyone is going to like that term, and so again, it might be an individual basis, but queer is just so broad that it can have so much nuance in it that sometimes instead of saying LGBTQIA+, we say queer. And then with the I that was added, that is meant for intersex folks. A is for asexuality, and the plus, one of those is two-spirited folks that came out of indigenous culture that our Native folks often use. And I think that would be a great conversation to have, to bring someone in and talk about indigenous culture and that two-spiritedness that they believe in. Yeah. As a white person, I feel like I don't know enough about that, which I'm definitely absorbing all the literature and stuff as possible. But I think for someone to speak on that person should be part of that culture.
Well, this today for me was so educational because we do a lot of work in the community, obviously, and it's about suicide prevention with the Be Nice Action Plan. And if we don't break the myths and we don't break that stigma down to really have good conversations, we're not going to save lives, and we're about saving lives. So thank you for opening my eyes today.
Absolutely.
And I hope that we get more opportunities to chat and talk. And then in addition, you're going to be out there thinking about, okay, Christy, you need to get this person on your podcast.
Absolutely.
Because that's what we're doing. We want to make real conversations and save lives. So thank you for listening to today's episode of Be Nice Podcast. Together we busted a very harmful myth, and we're going to keep doing it with more folks like Brittani. If anyone has any suggestions, ideas, please connect with us. But most of all, get to know what the Be Nice Action Plan is. Notice, invite, challenge, and empower. I want to thank Brittani today so much for helping us break down the stigma. Don't forget, if you or someone is struggling, there are resources available. Text NICE to 741-741. Call 988, and we will get posted on our website, the Network 180 contact number for the Mobile Crisis Unit. And always visit our website at benice.org. Check out our Facebook page and any other social media, because this interview will be live and will be posted on. Thank you so much. And most of all, take time to be nice.
This podcast is made possible in part by WKTV Community Media.